Good morning again, everyone, and welcome to the Children's Mental Health Matters webinar series. My name is Angie McRae. I'm the Child and Family Engagement Manager here at the Mental Health Association of Maryland. Today's session is being recorded and will be made available to you in the coming week. Our speaker today is Marla Lemon from the Parents Place of Maryland. She'll be presenting Enhancing Parent Engagement for the New School Year. So let's hear a little bit about Marlo. Marlo Lemon is Co-Deputy Director of Training and Strategic Partnerships at the Parents Place of Maryland. As a certified teacher and mentor, she has taught in elementary school and is currently an adjunct professor at Towson State University. Go Tigers. As a mother of children with IEPs, she strongly believes in making connections, empowering families, and being able to share valuable resources with other families, which leads to improved success for all children. So Marlo, thank you for being here today. We'll turn it over to you.
Thank you so much, and good morning, everyone. I truly do appreciate you taking the time, your lunchtime, or just time out of your schedule to come and share with us today as we talk about enhancing family engagement. I want to thank Angie and Mackenzie and everyone else on the team just for the invitation so that we could come and share. So again, thank you, Angie. My name is Marlo Lemon. I am a Co-Deputy Director at the Parents Place of Maryland. So today I'm just going to share a little bit about the Parents Place of Maryland. We're going to define family engagement and parent advocacy. We're going to talk about barriers for family engagement and school partnerships and how to support families for the teacher perspective, parent perspective, family perspective, and provider, because I wasn't quite sure how many we would have joining us today. Excuse me. At the Parents Place of Maryland, this is our mission. We were fortunate as of July to add behavioral health challenges, but our mission is to empower parents and families as advocates in partnering for improving education and health outcomes for students with disabilities, special health care needs, and those impacted by behavioral health challenges. What's so awesome is now we are, as I always say, one-stop shopping, because we are truly helping the family as family peer support. We have been around for over 30 years. We are governed by parents, so we have a board full of parents. All of our parents on the board have children with disabilities, special health care needs, or behavior health needs. What I appreciate is when parents or families call our office or send us an email or they need us. One, our services are all free. Two, this was originally scheduled in September, but we had a very big in-service with Dr. Pete Wright, who is the guru in special education. And the information that we give out is all evidence-based. And we service the entire state of Maryland. So from Ocean City to Allegheny, Garrett County, almost to West Virginia. So think about that. We provide one-on-one support to families, family peer support for disabilities, special health care needs, substance use, mental health, and problem gambling. Our goal is to wrap our arms around the parents and families to be able to help them as much as we can. We share resources. Our website is packed with information. We have topical trainings on anxiety, mental health, Good SAM, what is an IEP, IEP basics, so all of the things. And we have leadership trainings for birth to 5 and then 14 to 21 as young people are transitioning out. For school service or education services, we're birth to 21. For our substance use, mental health, problem gambling, we are across the lifespan. So please feel free to reach out or refer families, because we help them understand their disabilities, the behavior health needs, how to communicate not only in teams in the education setting, but with doctors, psychiatrists, insurance companies. It's all so much. So understand rights and responsibilities. obtain services for our loved ones, and then with community resources. What the expansion of our services has done is allowed us to have a family partner in every region in Maryland. So we are closer. We also have people who are just right there. I always say this is the most important slide in the whole presentation. These are my young people. I am the proud mother of three. This is my double blessing and little surprise. My young men are 20 and my daughter is 19, which I cannot believe. And I included my son Matthew in a picture by himself. This was taken this school year because he will be 21 in November. My son Matthew is on the spectrum. He's our gentle giant, nonverbal, and he will be exiting the school system in June, which I cannot believe. His twin brother with dyslexia, ADHD, anxiety. So we are a family that, are impacted by so much, but the joy, and this is why I do what I do. When you call our office, someone who has been through something or has that lived experience, you will be able to speak with, or if you are referring families. So how do we engage families? And let's talk a little bit about family advocacy. First, let's define it. Families and schools working together, families and professionals or providers working together, speaking up, advocating, getting involved. Actively engagement looks like I was sharing right before we started the call that even in today's times it can be extremely stressful because it's so many other things that's going on. But we want to remember communication, shared decision making. A lot of times in my role as a helper, as family support, I can't go in thinking I know what the family needs. It's shared. We have to take our cues from parents and families. What is it that you need? Because we know that the benefits of family engagement are vast. Improved student achievement, better behavior, and enhanced social skills are all the things that help with the benefit of family engagement. Let me stop right here and just say that some of you might have questions. Please feel free to put them in the chat. We are recording, and I am going to have time at the end to answer any questions. But if you can feel free, put information in the chat, and then we'll stop recording and have questions at the end. So thank you so much. This is the definition of family advocacy. It's action. In our mission is to empower parents and families. And as we empower them, we hope that action then takes place so that they feel very comfortable speaking up with behavior needs, education needs, asking for support that they need, understanding different policies, and letting them know it's okay to speak up. You are, for parents that are on the call, you are your child's best advocate. For professionals that might be on the call, you are helping the parents and families get to where they need to keep the children or the young people, whoever we are advocating for, you're empowering them. And we know that when we empower parents and families, that their needs are met and the children definitely succeed. It's important because of these three things. Research links family engagement to better academic achievements, academic performance. Research has shown that active family engagement and involvement is good for the emotional and social well-being of our children. And collaborative family involvement contributes to improved school climate and success. When we advocate for equal opportunities and resources, we ensure that all children have success and quality education or quality care. We also know that there are some barriers, particularly in today's times. I have just listed a few. If you can think of others, please come off mute really, and you can tell me if you can think of some other barriers to family engagement. Finances is really big, particularly now when we look at some families who might be furloughed or laid off.
I know health is on there, but I think mental health is a big one too.
Thank you.
Also, language barriers.
Yes, thank you.
Stigma.
And Eric, I didn't hear you.
Stigma.
Mm-hmm. Thank you. I love this because I can always add to
Legal
to the list.
status. Legal
Yes.
status.
Yes. Absolutely. And, as an aside for if you are a provider and you're on the call, and we know we have families that are hesitant because of legal status, so thank you. We ask no questions. We are a free service, if I didn't say that. We asked, of course, basic general name, I don't even in address, but guess what? If you don't give us address, we're still going to be able to help you. We come from a place of yes, and what do you need? So we're not going to ask legal status. We're not going to ask to see any documentation. And we are a free service to families because we ultimately want children and families to get what they need. In 2025, an interview with the school was done with school leaders, and they were asked to identify areas of family engagement that seemed to be a pain or pain points for teachers. And these are the things that they said. What we know is when educators have strategies for effective communication, which goes to that mental health, cultural responsiveness and humility, which goes to the legal status and stigmas, responsiveness and relationship building, they are better prepared to engage families. These are some strategies to overcome barriers. We want to think about a different time. Sometimes, and sometimes, particularly in our schoolhouses, we are very, very rigid. Is it okay if the team can meet at 8, if it's, to do that time, to think about our swing shift parents, those 11 to 7 people? Is it okay to, if you are a provider, are you modifying your shift that day to modifying your shift that might include a 6 o'clock call to a family? Definitely, definitely, definitely providing translation services and bilingual staff. That is so important. A lot of times Google Translate just won't do it. So whenever we're working with and thinking about and helping families, we really want to make sure that they understand the information that we're trying to give to them. Having cultural humility, knowing about different programs in the area. I am very happy to report that we now have 4 bilingual staff. So we are definitely able to help in English and Spanish and Haitian Creole. And you should be seeing some more mental health information coming out for our Spanish speaking families. We want to be able to utilize community resources. And that's why I'm excited that we now have family partners in every area in the state of Maryland. Building trust takes time, particularly in today's climate. And we want to be as considerate to each other's needs and, again, that cultural humility as we can. Additional ways that we can work to support families is just by collaborating and connecting them to local resources. And we tell our family partners, don't just Google. A family can Google. Is it a place that you can send them to? Not that I'm going to send Angie all of our client like, oh, just call Angie, but I do know that Maryland Mental Health Association, oh, reputable organization, will get you back, try to help you with resources as well. Can we think about Zoom meetings? Can we think about Facebook Live? Can we think about WhatsApp app? My daughter always tells me I say it wrong, so I apologize. But I do know that that is a way that particularly our Spanish families like to communicate. But then again, you have to think about your families who might be in rural areas and the internet is not really good. How are we going to get the information out to all the parents and families when situations are different for everyone? How are we going to have this information hub out to be able to support parents and families, to provide resources? Are we going to have regular meetings so that way they know if I log in or if I come, then this is a place that will be able to support me? A lot of times, you know what? It's a matter of asking families what they need, how they would like to be communicated with, and some of the places and information that they might know, but that involves having and building that trusting relationship. What we do know is that home and school partnerships really, really make a difference. So the beginning of this was family engagement in a new school year. It might be a new teacher, a new school building for some of our young people. I'm thinking about middle school, and I've never heard anyone who say that transition is easy. So if you have a young person who's going into middle school or who's leaving middle school, you know, understanding that the IEP document could be individualized education program document could be 50 to 75 pages. It's nice to have that little snapshot. This is my son, Johnny, and these are the things that he really enjoys. These are the things that he's good at. But we want to really have a welcome, opening environment so parents feel comfortable sharing that information, because connecting and engaging leads to sustained partnerships and positive outcomes for our young people, for our children. How can we, when I was building this presentation, I was thinking as parents and families, and I was also thinking as providers working with families. The first thing is to build those trusting relationships. In today's time, again, it's not for us, it's not about the legal status. How are we going to build relationships? Are we coming to your area? Personally, are we having workshops that are not in person because some of our clients and families don't feel as comfortable coming out, but we have the information we can give virtually? Asking parents what it is they need. And I will be the first to say, I don't want to make any assumptions and, oh, this is what you need. No, asking the parents and families, what is it that you need? That builds family engagement, that builds that trusting relationship. Of course, showing cultural humility. Don't just assume. Be consistent and reliable. And we want to celebrate the success. If the parent is like, I was able to call, I was able to get in touch, I made the appointment. It could have been a scary situation for us. It might be like, okay, I might call and talk to these people all the time. But for a parent and family to be able to call and get the information they need is a big deal. And we should really recognize that. I'll share a quick story on cultural humility and just not assuming. Early on, as I've shared, my son is 20 now. He started in infants and toddlers when he was 17 months old. As a result of him being in infants and toddlers, we had different people coming into our home. This was very, very early on, before he was even 2. I had just had my daughter, who is only 17 months younger than them. I just had my daughter. And my husband had just went back to work from paternity leave, and we had a provider coming into our home. And I had gotten the boys up and they were dressed and, I thought they looked pretty cute. I, on the other hand, looked like I had been put through the ringer. I was holding my daughter when the doorbell rang and I answered the door and I had my daughter in my arms. And I'll never forget, I had on short pair of jeans, shorts, and an orange tank top. My hair was back up in a ponytail. And I probably at the time maybe looked like I was about 16 or 17. And I opened the door and I'm so like my boys were up and they both qualified for services. And they were up and clean and I was so excited to get the help that I needed. Provider came in, she looked around, wasn't really all that personable, but I'm like, okay. And she instantly looked at my boys within a matter of 2 minutes and said, he's ready, he's not, you need to read to them, you need to do this, there was a whole list of things that I needed to do. She did not, which let me know she didn't read my file and know that, I was a former teacher, that they had been listening to, was that baby Einstein and everything in the womb, that, she assumed that I thought it felt like she assumed that I was a young single mom, 3 kids, not knowing what I was doing. And I probably looked that way, but I was so offended and humiliated. And every time I talk about it, it takes me back to that day because I just felt like she was extremely judgmental. Fast forward, she never came back to my home. However, we can't assume. It's always, be kind because you never know what someone is going through. So we really want to work hard on building, trusting relationships with parents and families. We want to strengthen communication. It is so easy to speak in professional speak, whether we are professionals on a call or in education. We want to avoid acronyms as much as possible. We really are trying to empower parents and families that they are their child's best advocate and they know them best. But a lot of times when we start talking about, OTRs and MSDE and IEP and MSD, so many acronyms, it's a lot. We want to steer clear from all of the jargon. A parent told me one time, the best thing someone did for me, her son has a disability and she was getting everything worked on for him. She was going through grief because she had lost a husband. And she said, someone called me and just said, how are you doing? And she said, I still keep up with that teacher today. This is when her son was in a 3-year-old class. He is now 16. And it was just because that teacher called and said, I'm just calling to check on you to see how you're doing. For professionals on the call, can our communication with families the first time maybe not be negative? Your child is doing this, and this. This is who I am, and I'm happy that I'm working with your child this year. We want to always also check for understanding. There are so many times we're using so many different forms. And when hopefully you always have an interpreter, or if the family says, no, we think we'll be okay, you want to really always check back, do you need anything? And then ask them, how do you prefer to communicate? Now we have texting through the computer. It used to be where, I don't want, families to have my personal cell phone number, which is totally understandable. But there's so many apps and other things out there that we can use for parents or families that prefer to text. We want to empower our families. We want to create the goals together. I did not need for that professional to come in and tell me all the things I needed to do. Instead of, I'm concerned that Matthew's not talking. Can we talk about augmentative devices? Can we talk about other ways to get him to communicate? Can we talk about a visual schedule? We want to offer choices so parents can decide how they need and want support and what that looks like. We don't want parents and families to feel like we are just checking a box. Okay, I've checked this box and I need to move on to my next family. We want to invite them as much as we can to collaborate. Some of you might be on a call was like, okay, well, that's why I'm coming. I want to know how do we invite them? Sometimes we have to continue, send that email, invite them to a program we're having, join this support group, And if they know we're coming from a place of concern or this might help eventually, we're hoping that they will, come to that meeting or participate or give us a little bit more. But they sometimes like our students need to know that we care first. Be flexible with time and location. Can we offer certain trainings or information in the evening during lunchtime like this is? Okay, I'm checking my time. Having different places and times to meet that fit into a family schedule. A lot of times we have our Spanish trainings like at 5 for those not 3 to 11, no, 11 to 7 families. So it just we try to really get to know where our families are so we can meet the needs and meet them where they are. Encourage participation. We want to make it meaningful. You all came here during your lunchtime for some of you, hoping to get meaningful information so we can connect to families. Is it relevant, useful? Do families feel empowered? We want to talk about a shared commitment. Family engagement isn't about one size fits all. It involves in response to the needs of the school community. What matters most is staying consistent, being family centered, and keeping students at the heart of every effort. That's what families want and deserve. There will be a link in the chat at the end of this so that you can share any feedback on the presentation. At the Parents Place of Maryland, we have coffee and conversation, and in November, we'll start having support groups as it relates to behavior and mental health. Coffee and conversations started during COVID and they've become so popular. And actually, our largest attending group is our Spanish speaking families. They come, they share ideas, have connections, discuss what's going on. We can talk about the latest resources, but I have one mom who comes to every group except Spanish because she has a child in the second grade, itty bitty, as we call them, a second grader and a middle schooler. We have newsletters once a month in English and in Spanish. So if you have families or if you are a family that needs that information, please sign up for our newsletters. And again, it's in education, behavior, mental health, substance use, and problem gambling. This is just a clip from our website. We have so many different resources and fact sheets. We pride ourselves on having fact sheets in a 4th, 5th grade readability level. And we do that because we know that sometimes schools and services can be intimidating for parents and families. And we want to make sure that they are getting information to help engage families or engage themselves. We are on all of the social medias, any different trainings that we have. Again, we're going to have one coming up on mental health in English and in Spanish. Please feel free to join us. We're on Instagram as well. This is our YouTube channel. We also know that some of our parents and families might be limited in some of their skills. And you might be a person like me who might want to listen to a video while they're driving. It's categorized. We have information for military families. We have a staff member who specializes in military, and it's different ways to engage them. Think about having a child who needs mental health, behavior health, or education services, and both parents are deployed. Employment service, so we have elementary to 25 and beyond. I am a quotes person. This is one of my favorite. Every child deserves a champion, an adult who will never give up on them, who understands the power of connection and insists that they become the best they can possibly be. I want to thank you for attending this afternoon. This is my contact information. You can reach us at ppmd.org. I just did a presentation on boundaries and it was absolutely wonderful. We have to remember, even in today's time, to take care of ourselves because you have to put your mask on first. You can't take care of others if you're not taking care of yourself. I'm going to stop sharing. We're going to start recording so then I can take questions. If you don't mind to start recording,